Thank you. So in general terms, if you have a diagnosis of angina, lifestyle changes are very, very important in terms of managing this condition. The most important is any risk factors that you might have. So if you're a smoker, it's very important to stop smoking. Smoking is a huge risk factor for developing coronary artery disease or narrowing in the arteries of the heart in the first place. But if you do have angina and you've already got established narrows in the arteries of the heart, then smoking actually increases the risk of heart attacks beyond the risk of developing the disease in the first place. So it's very, very important to stop smoking completely. Even smoking one cigarette can increase the stickiness of cells, which can increase the risk of heart attack. So that's a very important one. A second one, which unfortunately applies to a lot of us after lockdown, is the need to reduce weight. So if someone is overweight, then tackling that is a huge problem. It can be, but it is something that needs to be done in conjunction with dietitians and exercise programs. But losing weight will reduce blood pressure, which itself is a risk factor for further coronary artery disease type events. It will also actually help with exercise capacity. So if one's carrying less weight, then one's able to do a lot more. And your exercise tolerance before you develop chest pain or angina becomes less. But in general, in the long term, it's very important for people to have an ideal body weight. Coinciding with that is also dietary advice. So to make sure in general terms that people have lots of fresh fruits and vegetables, a low-fat diet, lean meat, avoid red meat, limit that if you can, and also to avoid saturated fats and sugar. Sugar is the big evil, really, because it's so plentiful, and such a little amount can cause a very big increase in weight, and that's probably the biggest problem that we face. So limiting one's sugar content, and if carbohydrates are being eaten in excess, again, that's another risk factor. Both the sugar and the carbohydrates, particularly in the West, lead to a condition in some people called central obesity, where any excess energy is converted to fat, and that fat is dumped in around the intestines. And that unfortunately increases the risk of diabetes, heart attacks, and just the development of coronary artery disease. So that's important. In conjunction with all of this, physical activity is very important. And actually, when we talk about physical activity, immediately people think that means going to the gym at 6 o'clock in the morning and pounding away for 3 or 4 hours. Well, that's generally not the case. Actually, the advice is much more moderate, much more modest. And really, if people just walk for half an hour every day briskly, that is a very, very good amount of exercise. And that's essentially what we're designed to do. So physical activity. Now, of course, the problem with angina is often angina, where you've got narrows in the artery of the heart, is provoked by exercise. So there will be people who have angina initially whose symptoms aren't under control, and therefore they will be getting angina before they can do very much. Of course, they've got to limit their exertion to the point that they're getting angina, but hopefully with medication, as their symptoms improve, they'll be able to do more. But again, depending on where they are, who they're being treated by, there should hopefully be cardiac rehabilitation classes available to help them guide them through that increasing physical activity process in a safe way. The final thing, which has always been in the literature and has always been difficult to define, is that nebulous thing called stress. Patients who have angina are very familiar with the fact that stress will provoke angina, but we also feel that stress probably in the long term is a risk factor for worsening of coronary artery disease and probably development of coronary artery disease in the first place. So limiting stress just from symptoms alone is probably a good thing for them to do, as well as trying to reduce their risk going forward. That's a really good question. So does angina require treatment? Yes, it does always require treatment. In the vast majority of people with angina, who've got what we call stable angina, so that's predictable chest pain coming on with exertion. We usually manage that in the outpatient setting, and the vast majority of them will be managed with lifestyle changes that we've already discussed, but with medication. The most important thing to bear in mind, actually, is in the modern world with the strategies that we have available, the vast majority of people with angina will have a very, very good outlook on medical therapy. Can it be cured? As things stand, current science, unfortunately not, but we can definitely reduce this likelihood of causing harm. And also, we have treatments available that can make people's quality of life excellent. So there's no reason that once you've got angina, you can't have an excellent quality of life with a very, very good outlook. But as things stand, we can't cure it, no. So that's a really good question. With angina, with any condition that we have in medicine, there are two types of medicines that we give. They're not always mutually exclusive, but they're those treatments that we give that help improve survival. So in the case of angina, reduce the risk of death, heart attacks. And those are what we call prognostic medications. And the prognostic medications that we have are aspirin, which reduces the likelihood of clots forming in arteries and heart attacks, and statins. And statins work by reducing cholesterol, particularly bad cholesterol called LDL, which will prevent further fat deposits developing in the arteries. And also, actually, the other thing that they do is the statins will make the plaques, the fat deposits that we have, more stable and less likely to rupture, which is the thing that occurs when heart attacks happen. So aspirin and statins are the two major classes of drugs that we give to try and improve people's survival. There are others, such as ACE inhibitors, which have been used for blood pressure control, which do confer some prognostic benefit or survival benefit. But in the great scheme of things, the amount that they confer is very much less than the aspirin and the statins. The majority of the drugs that people will be on for angina will be to try and improve their quality of life. With angina, the symptoms are mainly chest pain or chest tightness on exertion or breathlessness. And the sort of drugs that we use will be things like beta blockers. And beta blockers work by blocking the action of a hormone called adrenaline. Sometimes in the literature, particularly the Americans, call that epinephrine. And what that will do is to help slow down the heart and reduce the force of contraction of the heart. And both of these things reduce the energy requirement of the heart, which lessens the likelihood of developing angina. So that's how beta blockers work. Another class of drugs which is very commonly used is nitrates. So the nitrates, usually in a sublingual spray form, is something that most people will be familiar with. They help relax smooth muscle, which is muscle which are like rings around the arteries, the coronary arteries, and the blood arteries, the blood supply arteries of the heart. And they help dilate or relax those arteries to increase blood flow into the heart muscle. They're also prescribed in a tablet form, usually in a once-a-day medication, and work by the same method. Another class of drugs is the calcium channel blockers. Again, they relax those arteries, improve blood flow down those heart arteries, and reduce the likelihood of developing chest pain with exertion. And there are others which are newer, but these are the major ones that most people will be familiar with. Thank you. So that's an interesting question. So I think the first thing we need to do is to define what kind of surgery is available for angina treatment. Now, there are two major types of surgery. One is the traditional one that most people think of, and that is where a big scar is made on the chest, the sternum is opened, and grafts taken from the leg or from the arm or from the chest are put onto the narrowed arteries to bypass those narrows. So that's bypass surgery. That's the traditional one. But minimally invasive procedures are also available, and the most common that most people will have heard of is angioplasty. And that's something that's performed by cardiologists by taking a tube up from one of the arteries in the wrist or the top of the leg, and then a balloon is threaded across the narrowing and a stent is put in to open up that vessel and keep it open. With surgical procedures, either bypass surgery or angioplasty, the most common thing that most patients say to me when they come to see me is that they feel that must confer some kind of survival benefit, prognostic benefit. Now, for stable angina, which is what we see in the outpatient setting, actually that's not true. The vast majority of patients are best managed with medical therapy. And the surgical type procedures, either bypass surgery or angioplasty, is typically reserved for patients who have ongoing symptoms despite being on optimal therapy. So that's being on all those sorts of drugs that we talked about earlier, if they're still getting symptoms and their quality of life isn't very good, then either opening up their arteries with stents or bypass surgery is something we'd consider. And the choice between the two will be dependent upon the type of coronary artery disease they have, how extensive it is, what it involves, how much calcium there is, whether they've got diabetes and so on, and the risks for one procedure and the other. In terms of survival benefit for stable angina, there is a small subset of patients with angina who may have very extensive problems with blood flow into their heart muscle, in whom bypass surgery in particular might be of benefit. The role of angioplasty in angina really is primarily reserved for people who come in with unstable angina. So that's people who are coming into hospital with pain at rest, or with a minor heart attack or a big heart attack. And in those groups of patients, undoubtedly, there is evidence that angioplasty and stents improve survival. But in the outpatient setting, angioplasty is reserved for patients who are getting symptoms despite being on optimal therapy. So that's a really, really important question, because it's to do with the heart. And actually, we're very, very fortunate to be living in the world that we do. So the take-home message is, in the modern world, if you've got angina, there is no reason that you should not have an excellent quality of life with the treatments that we have available, and a very good long life with the treatments that we have available. And that's what the vast majority of patients should expect.